Hey everyone, Sean from RPHLA, Kevin from RPHLA, and now we have Dr. Andrea Leshak Leshak from
Less
RPHLA.
Less
Oh,
Shack.
what was that?
less check.
Leshak, perfect. So we are launching, Andrea's launching her patient advocacy program channel in RPHLA. A quick story with that one, I'm really excited about this one, probably one of my most favorite ones because you technically don't need a pharmacist license on that one, right? And when Andrea first started talking to us, I was like, I really wasn't sold on this channel, like before I met Andrea. But then we talked and I was like, wow, this is amazing. Like I needed you when my wife was going through breast cancer because I was lost as a pharmacist. I didn't have the right tools to really help her. And I have friends going through the same things. And it's like, it's amazing. So without further ado, I'm going to pass it over to Kevin to get into the discussion, Andrea. So thank you for coming. Thank you for launching this.
No, that's fantastic, Sean. And Sean and I had that conversation, just how kind of blown away he was. Like, wow, there's so much in advocacy. And you and I have talked, Andrea, about what you've said. Like, I am a advocate that happens to be a pharmacist, right? But the other kind of special thing is, if we're going to adopt our, bachelors of pharmacy or our PharmDs and go, this is where we should use it. Like the skill set and the mindset of an advocate is perfect. Like we know and we understand the inner workings of the healthcare system in ways that we probably don't even appreciate the level and depth of understanding of what's actually going on behind the scenes. And patients it's so difficult to walk through that matrix of what am I going to do next? Or what am I going to be billed for next or charged next? And what duties or responsibilities or options do I actually have? And I just think it's so special, the way that you've kind of gotten to where you're at right now in your career and what you're doing and the impactful work it is. But tell us a little bit about that. Like, how'd you get here, Andrea? And why is it patient advocacy now that you're just so passionate about and wanting to share?
Absolutely. And first, I want to thank you guys so much for having me here. I'm super excited. And so, yeah, I mean, it's really been an evolution. And it really started, about 15 years ago when I switched over into the long-term care space. I was a consultant with Omnicare back in the day. And I would go into these different nursing homes. And, if you've ever done the consulting model, really long med lists, you see the chaos that families are going through, you're looking at the falls, you're trying to tweak therapy. And, I was finding all these med errors and I started to view myself as an advocate. That's what I would tell people. I'm advocating for people's best care. And if my mom, dad, or grandma was in this setting, I want someone to have their back. And if you know anything about this space, there's fewer healthcare providers in it, and yet the acuity level is higher than it's ever been before. And so I was obviously a pharmacist. I was a consultant working with this advocacy mindset. And I did that for quite some time. And then I found myself where we were going to relocate. I was actually faculty at a university. I quit. I left the position, and 3 days later, I'm sitting on the beach with my sister, and I get a phone call that my dad's in the emergency department. And in that moment, we learned he had dementia. And I decided, you know what? He knows who I am now. I know the trajectory of this. I'm going to make the memories. And I just never returned to traditional work. I mean, that's really how that break came.
Wow.
And as I had that time off, I started thinking more about this advocacy piece. And what if I flipped the script? And I had a mentor who happened to be an advocate that was also a pharmacist. And just through time, I started looking at it going, well, what if I took 30 years of healthcare experience? What if I took the experience with my father in the subacute setting? And then last year when he fell and fractured his neck and we went into the ICU and that whole chaos of the storm, what if I just finally stepped fully into patient advocacy? Oh, by the way, that has the skills of a pharmacist.
Wow. No, I love it. So that was your transition, and kind of the epiphany moment was really, I mean, a very personal and deeply touching element to say, like, I know other people need this, like in general, not other people like other pharmacists, just literally patients need this. And the skill set you had just made you perfectly equipped to be able to do so. So with that, Andrea, I think the one interesting thing that I get questions on sometimes, and Sean even asked, like, what is the difference between like deprescribing and advocacy. What are the things, what is advocacy like in general, for us? Because I think from the pharmacy world like perspective, when we think about pharmacists advocating, like we're thinking about drugs, right? We're very much so thinking about drugs, drug procurement, patient assistance programs, those kinds of elements of perspective. But I wanted you to touch a little bit on, because you mentioned like the subacute care and some of the transitions.
Right.
When it comes to advocacy and like what we're meaning or talking about with advocacy, how is what you're doing so much broader and different? I mean, not to say that, I mean, we just talked to Donna the other day. She's fantastic, and you should definitely learn about deprescribing from her. But why is the deprescribing elements and the med kind of stewardship, a part of things, but advocacy is a whole nother section?
Exactly. So I'm going to use some comparisons because I think it really helps when I tell the stories to also wrap your head around the nuances of it. Broadly speaking, patient advocacy is healthcare navigation and decision support. So if you were to like Google what is patient advocacy, that's what you're going to come up with. So if you were standing on the moon looking down at the planet Earth, you're going to see deserts, you're going to see mountains, oceans, continents, right? So within the continuum of patient advocacy, you're going to see a variety of healthcare providers or non-healthcare providers acting on behalf of patients, right, as they navigate healthcare. So you're going to see attorneys and social workers. You may see a certified nursing assistant. You may see a pharm tech, right? You can see a family member advocating. And so, as you mentioned, it's a unique space where there is a board certification in patient advocacy, but you do not have to be a pharmacist to do that. And so then if we were to carry this even, to be a little bit more myopic and compare that, what's the difference between a pharmacist who advocates and an advocate who happens to be a pharmacist? I find the easiest way to describe this is through my gardening scenario. So imagine that, Kevin, you own a greenhouse, right? So you own a greenhouse and you grow seedlings. And within your greenhouse, you can control the environment that those seedlings exist in, right? You control the water. If there's pests, the temperature, the kind of nutrients that those seedlings receive. And so you are focused on making sure those seedlings are the best seedlings in your environment that you can control. Sean comes to your greenhouse. He's going to buy some seedlings. He takes your seedlings home and he plunks them into the soil. Now the care of those seedlings is influenced by Sean as well as the broader environment. Kevin, you no longer can control it.
Nope.
The planet, where those seedlings have been placed, the soil, the temperature, if they're on the north side of a building or whatever, that's going to influence how they grow. And so when I talk to pharmacists, are you a pharmacist advocating versus an advocate who has the skills of a pharmacist? Kevin, you may make the most whiz-bang beautiful treatment plans, and you may deprescribe or make recommendations that, really set a patient up to thrive.
Well,
and yet, the minute they get into their car and the cell phone rings or a check bounces, or a kid is late at daycare, all of a sudden, the environment is controlling the success. And in chronic illness, or in particularly in moments of an acute illness, Sean, you referred to, the cancer diagnosis. I mean, my mom had cancer metastasized to her brain. I mean, all the knowledge I had in a moment, it just vanished because you are in the storm of the person. And so, when you're looking at advocacy, you're really working on that navigation, helping people, that are maybe grasping for a lifeline, and guiding them through it as they try to, arrive on the other side with some kind of confidence, peace of mind, and positive outcome.
Wow. No, I love that. That is a fantastic kind of comparison. And Sean, if I sell you seedlings, my friend, they're going to be really expensive. So you just know that. No, with I think the next, kind of question and curiosity is, Sean and I were lucky enough to be able to have 2 recent meetings with, was it Sean, 25 incredible thought leaders that have joined RPHL, including Andrea, just to go over like the future of the profession, things that are going on inside and outside of the profession, how to build community, how to make sure that the educational offerings and the support offerings that we're putting inside of RPH Ally are valuable. And so that really boils to this question, Andrea, for you is, why RPH Ally? Like, why did you feel like, I feel like the skills I have and the things that I've been developing, this is a spot where I want to bring it?
Right. Well, there's many reasons, and for time, I mean, I have to be mindful of that. I think with respect to what we are building at RPH Ally, as I mentioned, next year's my 30th year as a pharmacist. And in that time, I have turned the aircraft carrier a handful of times. I did my decade at Walgreens. I did, 7 years as a consultant, some time as faculty. And, as I became more seasoned and personally was looking at the chaos in this system, and because my life demanded, a different way of working, I became more open to other opportunities within the profession. It's hard for me to sit back now and think, I want to continue to practice traditionally as a pharmacist because I've been doing this for 30 years, right? So is there something new to keep myself, engaged, excited, in the second half century of my life? And that's really where, RPH Ally, you guys came in at the same time that I was working with this, because I think there's a lot of pharmacists that are looking for ways to expand their reach. Maybe they have an interest in a specific disease state, but they don't want to be in the weeds of disease management or drug management, right? Maybe they've had this personal encounter with a family member. They've seen the chaos. And so they just want to, take those skills and share it at a different level. It's not inherently better or worse. It's just a different way. And after, practicing within very traditional models of pharmacy, being in the weeds, I kind of wanted to step in front of the net and be like the goalie, and now I never know where the questions are coming from. It's an exciting opportunity, but then I'm also have the space for that one-on-one connection that I did not find in a traditional model. We're allowed to do that here.
Yeah, no, I think that's perfect. And I think that the patient advocacy thing that Sean and I have talked about is when we were in our, traditional roles, myself in a hospital setting, Sean in some very large, like corporate settings, having those advocacy skills, like having the knowledge that you're able to apply, helps every pharmacist. Like, we become better practitioners knowing these things. And at the same time, like you saying you're going in a less, traditional kind of route, there's also huge opportunity within the healthcare navigation space for folks with our kind of background and knowledge to take a whole different kind of career trajectory and take advantage of it. So that's perfect. I love it, Andrea. Last question for us is this one. When someone comes into your channel and they're gaining all these educational insights, what are they going to experience? Like, give me the full meal deal.
It's interesting because I did tell you guys that I was interestingly nervous coming into this, because I've been on a number of podcasts. I've done these before. I've talked about this before. So I was really reflecting on, why does this make me feel more anxious? And I think part of it is that I know that I'm speaking to pharmacists or pharmacy technicians or people within our space. And as a pharmacist, we love guidelines and algorithms and something that is very if this, then that. Yep. Patient advocacy is not that. And so as I bring it to this platform, and I look at like some of the curriculum outlines, I was like, wow, if I thought of 5 questions that I've been asked, there's absolutely, there's no continuity to them, because we have system challenges, we have disease state challenges, we have potential people challenges. It's about, how do you have a hard conversation? Maybe you don't agree. Like in your mind, you're listening to what somebody's saying, and it's like, wow, I can't wrap my head around this, but how do we have that conversation? And so within the channel, that's where it's going. We're going to broadly talk about business fundamentals. We're going to cover, so we have the business fundamentals, we have the mindset, and then health and wellness. Because what I've learned as an advocate, and particularly as an entrepreneur, is that you are your brand. You become your business, right? And if we are around people that are in chaos, pain, and you know, some very heavily charged emotional moments. How do we be with them without taking that on? And so, yeah, we're going to talk about how do you build a business and some marketing aspects of it. What is the difference between being a patient advocate as a pharmacist? Maybe you just want to bring more advocacy in, right? And you're going to practice within your state. We'll cover some of that. The ethics behind it, you know, because there's a lot of gray. The collaboration of it. I've found this space to be incredibly welcoming because people know that you can't be all to everyone. So it's less, I don't want to say it's less competitive, but I do feel much more of that rising tide lifts all boats. We're definitely going to dig into some cases that have popped along the way, just random questions that I've been asked. And so, yeah, it kind of covers all of it. But the beauty of it is that you can also bring all the pieces of who you are into your advocacy space. So there are some that are incredibly, you know, that have approaches that are a little bit more soft skills, right? You know, I hate, you know, for me, I'm a little bit more of put the armor on and hop into the arena, you know? And I definitely think win-win, and I definitely seek common ground, but I'm willing to take, you know, the shots if that's going to get you where you're going, right? And so your personality, your interests, all can be woven into how you decide to advocate.
That's perfect.
That's awesome.
Everybody will look forward to kind of that overall experience of just getting able to be with you and someone that is willing to put that armor on and jump in the arena with them as someone learning kind of the practice as well. So that's wonderful, Andrew. We're so thankful for you. Sean, I'm going to kick it over to you, buddy, for signing us off.
Yeah, no, this is awesome, Andrea. I just love that you're going to do that with them, and it's for like an entire year too. It's like no, you're here, you're learning. We're not going to knock this out in a couple of days. It's like, no, this is a year-long process, and then at the end, they'll be ready to take this on. So, what Kevin said earlier about the community, that's what we're building. It's happening soon. I mean, it's already happening, but it's like it's going to get better in the next month or so when we do some adjustments. Andrea, we want you to get plugged into patient advocacy. Just join at rphla.com and then just click on her channel to start following along. Okay.
Thank
you, Andrea.
Have a great rest of the day, guys.